Today is the day. Now I am officially having knee surgery in like a few minutes. But I'm so early, there's no one here. Like, the hospital's not even open yet. Look at that. There is no one here. I have to go to number 3. So technically the hospital doesn't open until 6:30. But I just thought I would come early because, I don't want to be late. It's so spooky. No one. I'm kind of nervous about having surgery first thing in the morning. Like, what if the surgeon, woke up on the wrong side of the bed today? Did he get all of his breakfast? Is he good? I mean, he might need one surgery to get focused for the day. He might have to knock one surgery out before he gets serious. You know what I mean? I don't want him operating on me, and he might be tired. No, I'm sure it'll be fine, but I'm just nervous. There we go. Got my little, look at that. Do I look handsome in my gown? I gotta shave my knee and my leg, get ready for surgery. Oh. Okay, she's telling me I have to put my phone away because I'm having surgery.
You can have it until we go up.
Oh, okay,
yes,
okay, perfect. There you go.
This is...
My skin dry as hell. Oh my God, shaving that, my whole leg turned white. Couldn't show you guys that. Embarrassing. But now I'm waiting. And so, I am out of surgery. And I'm so hungry. But they have given me fructose. Fructose. Soft. Au thé. Mais sucre. So, get my blood sugar up, and then go home, I guess. But my knee is okay. Oh no, what's that? Oh, it's just gray hair. Yeah, so I'm gonna get dressed. Go home. Oh, that doesn't look good. Well. And when you're out of surgery, you get a taxi. It's called, I can't pronounce the name, but it's a patient taxi that takes you home for cheaper. Huh? Yeah, how do you say it? Patient Reisa. Patient Reisa. Yeah, that. All right, so I'm back home. And man, the pain meds got me sweating, man. I tell you what. Patient Reisa, the taxi for people coming out of the hospital, it was supposed to cost, I think, just like a little bit of money, but I got mine for free, so I don't know. When he dropped me off, he literally just said, okay, holla. I was like, okay, talk for two then. So that's cool. This is what my knee looks like right now. So I'm gonna elevate it on my bed, and then physical therapy starts. They said it's supposed to take 3 months, but I'm really trying to knock it out in 2. I'm definitely not trying to do 3 months no rehab. My muscles gotten a lot smaller since it hasn't been used, so I just gotta get on the ball, and I need to have surgery on my other knee as well. So yeah, got that coming up. But yeah, that was knee surgery in Norway, so thank you for following along. And if you want to know how much the knee surgery cost me, comment down below. I'll make another video about it.